Hi, everyone, and welcome to this session titled Embarking on an AI-Enabled Healthcare Solution Journey. My name is Karen Jacquart, and I'm a Senior Manager on Canada Health Infoway's Innovative Technologies team. Our team was established about a year ago, and our mission in a nutshell is to accelerate the adoption of innovative technologies within the healthcare system to positively impact health outcomes. One way that we approach this is by developing a toolkit for implementers of AI in healthcare, and that is what I'll be talking about today. I have three objectives for the session today. The first is that I would like everyone to leave with an understanding of why a toolkit focusing on AI implementation is needed in healthcare right now. Second, I want to leave you with an understanding of what you will find in the toolkit, as well as who the toolkit was specifically written for, and conversely, who it was not written for. And then, of course, if I've accomplished objectives 1 and 2 sufficiently, I hope that you will head over to the toolkit, download it, read it, and of course, use it. To achieve these objectives, I'm going to start by talking about AI in Canada and provide some real examples of where AI is impacting health outcomes. And then I'll spend the remaining time covering at a high level the contents of the toolkit. So as I mentioned, the Innovative Technologies team was formed about a year ago, and AI quickly became a focus area for us, and we began our journey. The minute you start to research AI in Canada, you quickly realize that Canada has a very rich history in AI and is a global leader in acquiring and training AI talent. As a nation, Canada has been making an impact on AI research since the early 1980s. Since that time, and even earlier, since the inception of AI has experienced its fair share of hype, as well as periods known as AI winters, where excitement chills and investment slows down in the space. With that in mind, you might be thinking to yourself, why AI? Why healthcare? Why now? This latest round of excitement around AI in the last 5 years or so has really been propelled by advancements in computing capabilities and broader access to these capabilities, as well as the vast amounts of digital data that have been accumulating. So in healthcare, this is directly due to the adoption of EMRs and other electronic data collection tools in the health setting. And just a small sidebar here, I think it's commonly known, but in case it's not, artificial intelligence is reliant on huge amounts of good quality and representative data for development of solutions. So back to the Canadian story. In 2017, Canada was the first nation to develop a national AI strategy. CFAR, the Canadian Institute for Advanced Research, was funded $125 million to develop the strategy with some key program areas, of which the cornerstone is their CHAIRS program, which is affiliated with the 3 main research institutes, so the Vector Institute in Toronto, Mila in Montreal, and AMI in Edmonton. This is a huge investment in talent and research and development, and as it turns out, 30% of these chairs have some affiliation to healthcare. It was because of this high interest in healthcare that in 2019, CFAR put together an AI for Health task force to identify some of the opportunities and challenges for AI in health. They identified 3 main application areas and potential uses for AI. This included healthcare delivery, disease prevention and public health, and discovery and development of diagnostics. Of course, they also identified challenges that the field is facing and that need to be addressed in order to really realize the full potential of AI in health. The key challenges that they identified were AI data infrastructure, accelerated development and deployment of applications, and the development of an AI for Health national strategy. Infoway read this report intently. We also started speaking with other organizations in the space and reading other reports put out by other organizations, the Royal College's AI and Emerging Digital Technologies report, for example, and started to get an idea of the landscape in Canada. We recognize that first and foremost, AI is a very busy space. We have world-class research institutes, our startup community is thriving, and federal and local governments are investing heavily in infrastructure platforms. Additionally, we know that we have some hospitals doing leading work in the space, not only deploying solutions, but developing solutions as well. We agreed with CFAR's analysis and their call to action to develop a pan-Canadian AI for health strategy, but knew that this was too large a task for Infoway to take on. So we started to look for gaps in the landscape that we could address. The gap that we honed in on was that of taking AI from idea to implementation for healthcare delivery organizations that do not necessarily have the resources or the experience that the larger hospitals do. And this was essentially the starting point for the development of the toolkit that I'll talk about during the second half of this presentation. I want to spend a little bit of time talking about how AI is actually making positive impacts to healthcare and why this doesn't seem to be just another round of AI hype. The first point I'd like to make here is that AI can enable many types of applications, from clinical applications that directly impact patient care to research and development applications that can accelerate drug development processes, to administrative applications that can be used to better manage organizational resources, to detection and diagnosis of disease. In Canada, we are seeing examples across all of these application areas, some of which I would like to highlight here. So from top to bottom, Providence Healthcare in BC introduced AI technology to detect compliance with PPE to mitigate the spread of COVID-19. The UHN's Princess Margaret Hospital has begun using AI algorithms to develop radiation treatment plans for cancer patients. And not only is UHN using this tool, but they actually led the development of the solution. The CHUM in Montreal is using a Canadian-developed AI solution to predict hospitalizations and patient demand for supplies, essentially optimizing their supply chain using AI. And finally, Humber River has introduced a robot called Pepper to help patients wayfind through the hospital, as well as provide some entertainment to patients and their caregivers. As I said, AI is here and is having positive outcomes on all kinds of metrics, and the evidence is building to further adoption and deployment. So I just spent the last slide and a couple minutes talking about some of the real and positive impacts that AI can make on health outcomes, but is AI all good? The short answer is no, it is not. AI-enabled technologies traveled with new and heightened risks. Algorithms can produce biased results if, for example, the training data is not representative of the population that the AI will serve, and this can lead to harmful consequences. Things that we didn't have to think about before in the world of digital health, we have to start thinking about now. For example, as organizations started implementing EMR and digital health tools 15, 20 years ago, we weren't talking about things like bias. We weren't talking about explainability, and we weren't talking about unintended consequences of these solutions. We were thinking about privacy and security of health information, downtimes and bugs and things of that nature. Now, as we begin down this path of introducing AI technology to the health system, we cannot not plan for these new risks and considerations if we really want to mitigate and reduce potential harms that they have the potential to cause. And this is a key coverage area for the toolkit. What are the net new, or what we call the delta considerations, that implementers must start thinking about as they begin their AI journey? So with that said, Infoway worked with Carol Poivison and her team at Inc. Law, a leading law firm and data consultancy with deep expertise in AI risk management, to develop a toolkit for implementers of AI in healthcare. One of the questions we try to answer with the toolkit is, how can we move from idea to implementation in healthcare delivery organizations faster, but in a way that does not compromise the trust of Canadians and the trust that we have in our healthcare system? We landed on a 6-part series targeted at smaller to medium-sized hospitals and other healthcare delivery organizations. And I'm going to spend a little bit of time talking more about our specific audience in a minute. But generally speaking, the modules provide both policy discussion and operational guidance for responsible AI innovation, with the ultimate goal to improve health outcomes. This table is used to illustrate, within that busy landscape that I referred to, who exactly Infoway is targeting with this document. If you look to the bottom right, you'll see healthcare delivery organizations focused on healthcare outcomes that are just beginning. You'll see that this is dark green coloring. This is the sweet spot for the toolkit. The more experienced you are, the less relevant the toolkit might become for you. The middle two columns represent the private sector. While we think that their customers, healthcare delivery organizations, will benefit from the toolkit, we consider them more of a secondary audience. And then on the left, we've called out the research ecosystem, who are much more focused on core research and solution or algorithm development. And this document was not intended to get into the level of detail that they might be interested in. We recognize that people are very busy and that in total, the toolkit is about 90 pages in length. So with this table, we offer a bit of guidance on where different roles within the organization should spend their time within the document. This table is found in the introduction of the toolkit, so I won't spend too much time here. I'm going to take the remaining time to acquaint you with the contents of each module, who the intended audiences are, as well as the main learning objectives. So module 1 level sets on AI in healthcare. We explain how AI is defined. We talk about why you would want to adopt AI and why now. And we introduce some examples of AI currently used in healthcare here in Canada and highlight some of the potential benefits. You could think of this as a brief 101 of AI in healthcare. This module is intended for a broad audience, from clinician to administrators within the hospitals, but also any Canadian who just wants to understand a little bit more about AI and its potential in health. Our goal here is to improve the basic understanding of AI in healthcare before we launch into some of the heavier topics associated with AI, like risk, regulation, and governance. I mentioned earlier that AI-enabled solutions introduce an entirely new set of risks to the organizations. These are the considerations you must think about in addition to the usual processes, procedures, and tools that you use to implement digital health technologies. In Module 2, we begin to identify what these net new risks are. For example, algorithmic bias, explainability, unintended consequences that can arise from AI, and new privacy and security risks. Additionally, we introduce the concept of privacy enhancing technologies through 2 case studies that are found in the annexes, where we discuss some of the pros and cons of using synthetic data and federated learning, 2 methods that address privacy concerns. The audience for this module are those individuals focused on risk and risk mitigation. We direct risk, privacy, and security officers here specifically, as well as other leadership roles within the organization. Module 3 is where we explore the emerging regulation around AI, not only here in Canada, but across the world, to see what other regions, the EU specifically, are doing to put safeguards in place around data use and de-identification, automated decision-making systems, and explainability. The objective of this section is to showcase the emerging legal response to the uniqueness and complexity of AI systems, and should at least directionally provide a sense of where regulation is heading, allowing your organization to prepare appropriately. The audience for this specific module is broad. Here we are really not limited to organizations just beginning their AI journey. Even experienced organizations are going to want to stay on top of the regulatory landscape to ensure continued compliance. In Module 4, we discuss and provide practical tools to identify an organization's risk appetite for innovation, as well as a framework to help organizations start thinking about viable opportunities to introduce AI-enabled solutions and their level of readiness to do so. We also touch on how to plan and implement a successful AI project in health. This module is aimed at roles within the organization that are focused on strategy development, innovation initiatives, and leadership roles in general. I wanted to highlight here that during the development of the toolkit, we reached out to various sites across the country to talk about some of their implementations. We were able to include 3 case studies found in Annex 6 that highlight some really interesting uses of AI 2 from Eastern Health and 1 from the SHUM. Personally, I can say that meeting with these teams and learning about their projects was probably the most inspiring part of the Toolkit development process. Additionally, collecting and sharing implementation stories from across the country is a role that Infoway will continue to play in the AI landscape here in Canada. So if you have an AI implementation story to share with us, we've provided a link in the toolkit as well as on Infoway's website where you can connect and share your experiences with us. Module 5 focuses on change management and offers practical considerations for leading AI-related change management strategies. Again, here, I would like to highlight the fact that we're addressing the net new change management considerations that AI solutions introduce. We pay particular attention to trust and regulation in this module and provide guidance on how to ensure you are building trust at all levels of the organization and throughout the entire project lifecycle. The target audience here is senior leadership, AI project and program leads, and change managers and educators. And we want you to develop an understanding of the practical steps involved for effective change management to achieve your organization's AI roadmap. And finally, module 6. This is the module I like to call the meat and potatoes of the toolkit. Here we discuss how to develop a governance framework that covers the people, policies, and procedures that need to be in place to implement AI responsibly. The contents of this module should be used to steer internal discussions on AI governance and also provide emerging best practices on how to do this. This is where project teams will find very practical documentation, for example, a vendor assessment checklist or guidance on what explainability might actually look like for an AI solution. A small tidbit about me is I used to work on digital health implementation projects at the University Health Network in Toronto. I was a part of a few different project implementations there, and this was before AI was a thing. But if I was still a project manager working at a healthcare delivery organization, this is the module that I would keep open on my desk, similar to the way that I refer to my cookbook while I'm doing meal preparation. This module to me is the cookbook for project delivery teams, and where there's great opportunity to really get your hands dirty when it comes to good AI governance. Okay, so what else might you want to know about the toolkit? So each module is 8 to 15 pages long, and its total length is about 90 pages long. There's no cost to use the toolkit. The toolkit will be available in both French and English. The modules will be downloadable individually or as a complete set. And Infoway will be delivering a series of 5 deep dive webinars in January and February. I provided an overview of the toolkit today, but these planned webinars will get into the content of each module more deeply. So please keep an eye out for those. And of course, we are always interested in hearing feedback. We believe that the toolkit will evolve over time. So we're happy to hear from you about topics that you would like to hear more about. As I mentioned earlier, Infoway will continue to collect and share implementation stories from across the country. So we invite you to please share your stories with us. So that's all for me today. Thank you for your time, and I hope I've sparked your interest enough to head on over to the toolkit and take a look. I'll now open the floor to any questions.